Special stains are special because they are not routine. Therefore, special stains refers to any staining technique other than hematoxylin and eosin. Routine hematoxylin and eosin staining is important for providing the details of tissue and cell structure as well as differentiation of cellular constituents, especially the cytoplasm and nucleus. However, examination of hematoxylin eosin stained tissue may raise some questions. Special stains are important on this basis because they can answer specific questions. They allow the target substances to be identified based on their chemical character, for example, calcium, iron, DNA, and RNA, or biological character, for example, connective tissue, nerve fiber, and myelin, or pathological character, for example, microorganism and amyloid. In this lecture, we will discuss about some special stains which are commonly asked in examination, as I have made this lecture for my students. So the first stain we want to discuss here is the stain for iron. As you can see, this image is stained with the hematoxylin and eosin. The iron deposits are shown as the golden yellow. Now see the second image. There are lots of blue color deposits. These deposits are iron that have been stained by Prussian blue or pearl stain. So the color it will give to iron is the blue. That is extremely important. Moving ahead to calcium, at first see the available stain for calcium. These are Boncosa, Eliger red S, and calcine. Among them, Boncosa is commonly used. In this image, you can see the black color deposit. So Boncosa give the black color to calcium. Now see the staining for fat. In the first image, you can see the orange-red globules. These are the globules of fat stained by oil red O. In the second image, you can see the globules are stained black. Hence, these are stained by Sudan black B. Now see the list of special stains available for fat. These are the oil red O, Sudan black B, and osmium tetroxide. So you can easily remember the name with the help of the color they produce. Moving ahead to the stain for melanin. As you know, melanin gives pigment to skin, hair, and nail. In the normal hematoxylin and eosin stain, it will give the black-brown appearance. For better visualization, we use the Mason Fontana. Moving forward to the stain for myelin. It is Loxol first blue or LFB, and it will stain the myelin blue. It is extremely important when you deal with certain demyelinating disorders, especially in the CNS. In the first image, you can see the spinal cord stained with Loxol first blue. In the second image, it is the cut section of pons stained with the mixture of hematoxylin eosin and Loxol first blue stain. Next one is the stain for mast cell, and it is toluidine blue. And you can see there are purple granules inside the cell stained by this stain. Moving ahead to the elastic tissue, the list we see here are the Verroy-Benjason and Orsin stain. Orsin is also familiar with the staining of some diseases, some marker of diseases, just like HBsAg. Stains for DNA, it is fusion stain. Now moving ahead to the stains for amyloid. It is very important and favorite questions for examination. At first, see the list of stain used. These are the Congo red, methyl violet, crystal violet, thioflavine, and PAS stain. See the image shown here. It is the renal glomerulus, and you can find out the greenish deposit within. These are known as the apple green birefringence. Now the question is, what type of microscope is used here? The microscope is polarizing microscope. So whenever you read about the amyloid, you must need to remember three things. These are the Congo red, apple green birefringence, and polarizing microscope. The next one is the stain for neurofibrillary tangle. It is the Biel-Shosky stain, and it is a kind of silver stain and extremely important for demonstrating the nerve fiber, neurofibrillary tangle, and senile plaques, especially in Alzheimer's disease. Stains for Mycobacterium. Okay, it is well known, and you can see these are the red bacilli in the blue backgrounds. Now moving forward to the stains of H. pylori. The special stains commonly used here is the Warthin starry silver stain. See the first image showing the black color stain of H. pylori. They can also be stained by hematoxylin eosin, GIMSA, and can be better visualized by immunohistochemical or ISC staining. Now come to the stains for reticulocyte, though it is from hematology. Reticulocytes are just one step behind the mature RBC. So what are the bluish materials showing within this indicated cell? Reticulocyte contain the RNA that is shown blue in supravital stain. Vital means living, so supravital stains means staining of a tissue in its living form outside the body. Remember the name of the staining, it is supravital staining, and the dye used here can be new methylene blue or brilliant cresol blue. Now we want to discuss some special stains in detail. First of all, the PAS stain. PAS stands for periodic acid Schiff. It is a staining method used to detect polysaccharides such as glycogen and mucosubstances such as glycoprotein, glycolipid, and mucin in tissue. Before moving forward to specific examples, see the 4 picture overall. The PAS staining gives the color magenta to any kind of tissue. Now see the first image. There are magenta pink dots present on the cell. These cells are the lymphoblasts and they are positive for PAS staining, and we call them the block positivity. The second image is the renal glomerulus, and the basement membrane is stained with PAS, and it is extremely important as several important diseases occurs in renal glomeruli. In the third picture, there are multiple fungal hyphae. And remember one thing, these fungal hyphae can be stained black with the Gomorrhea methylamine silver stain. The fourth picture is the section of liver showing the storage of glycogen in case of glycogen storage disease. PAS stain has some other application as like the mucin in the goblet cell and in many other tissues. The next one is Mason trichome stain. As the name implies, the trichome stain uses the 3 different dyes to impart 3 different color on collagen, cytoplasm, and nuclei respectively. Mason trichome stain distinguishes the cell from surrounding connective tissue and to diagnose the fibrosis especially, and they are used to detect the muscular dystrophies, cirrhosis of liver, glomerular fibrosis, and some other cardiac abnormalities. So before ending this lecture, we want to recapitulate the routine hematoxylin and leucine stain, as it is most important and most widely used stain which stain the nucleus blue and cytoplasm pink with other structure, takes different shades and use with different combination of this color. The HN stain is extremely important to diagnose any growth or neoplasm. On the other hand, the special stains can also help in diagnosing the neoplasm, but in more than 90% cases they are used to detect the microorganism and medical diseases other than neoplasm.